Would you like to introduce yourself?
I'm Yalda. I'm a cosmetic doctor based in Sydney, and I do have a social presence as well, and I try and make educational content online.
If you're happy to jump in to some of the questions, we're getting a lot of people ask when to engage with a skin specialist and what kind of skin specialist they should see, and when do they see perhaps a cosmetic doctor like yourself, or a dermal therapist, or a dermatologist, or a doctor.
It can be quite overwhelming for people to know who to see and when to see them, especially because we have so much free information online now, whether that's through socials or with the help of AI, for example, now that I'm seeing a lot in clinic. But realistically, I always say just take it like down to basics. If you're struggling with anything medical, so if you think you have a medical skin condition, this could look like any type of dermatitis, whether that's eczema, perioral dermatitis, periorbital dermatitis, psoriasis, rosacea, any of these conditions, you should be seeing your GP first. Your GP is your port of call. GPs usually can manage all of these skin conditions really well, even if it takes a few back and forths to get the right treatment. Sometimes with any skin conditions and their treatments, it does take a bit of trial and error with different medications and topical creams, so your GP can manage that, and having a good relationship with a GP that you trust is really important. And if they think, actually, we've tried everything, I think you need specialist help, this is where a dermatologist will come in. So that's like your basic medical, your GP, and don't try and manage it at home is the other tip, because I feel like because we have so much free information now, people will be like, oh, I've tried this, I've seen this on TikTok, I've seen this on Instagram, and sometimes you can do more damage to your medical condition if it's not being treated properly. So that's if you feel like your skin needs medical help and attention. A bit of a grey area with cosmetics, I'll cover that in a second. And then you don't have any skin conditions per se, but you want your skin to feel and look better, which is absolutely fine. You want it to be brighter, you want less pigmentation, you want to tackle the dehydration, less fine lines and wrinkles. Then it really depends on the age and the severity. If you're young and you've never seen anybody even for like facials or an easy cosmetic treatment, then I would say go to your closest spa type clinic where you would see a facialist, a dermal therapist. These practitioners have a wealth of information. They can help with putting you on a good skincare routine, doing some mild treatments like very mild chemical peels or microneedling, or even like LED therapy. So you've definitely got that group of practitioners for that. And then you've got basically where I would come in, which is a cosmetic doctor. And then I would usually say this is when you have seen that dermal therapist and you think, you know what, the treatments that have been offered aren't good enough to tackle the treatment or strong enough to tackle the concern. Then you would see someone like myself where, you know, a cosmetic doctor does provide a more intense treatment. Cosmetic doctors obviously perform medical procedures which come at high risk, and a lot of them are prescriptive only, especially in Australia. So with those treatments, like I said, they do have their risks and pros and cons, etc., but they do provide a quicker, stronger result than if you were doing something at home or with a dermal therapist over a period of time.
What items or treatments or products do dermal therapists, for example, have access to that someone like me just shopping at the local chemist won't?
So that's a really good question, and I would say that I've been in the cosmetic industry now for nearly 10 years, and different dermal therapists and I would say spa-like clinics have different expertise and treatments available. It's hard to say like what you can find where. Different practitioners will provide different things. I would say that usually you're looking at your facials, your chemical peels, your microneedling treatments, LED therapy. They would be dermal therapist kind of treatments. Some dermal therapy clinicians can use lasers. However, they will not be as strong as what you would find a cosmetic nurse or a cosmetic doctor being able to provide, or a dermatology clinic with a nurse performing those treatments, because most of these devices will be locked based on the settings that you could do and your expertise per se. I'll give you an example. Morpheus 8, which is an RF needling device. The settings that I can use as a doctor will be different to the settings that a dermal therapist can use, and the company actually locks your machine at a certain level based on who's using it, just so you don't do damage to that person's skin.
Wow, that is so interesting. I didn't know that. So that's a really good example. I think there's also this, what can I actually do at home? How important is the home piece compared to the treatments that you're spending a lot of money on in office and that are probably very targeted? When is it time to give up on your skincare routine in the sense that you need an extra head, whether it is to start to engage with your local GP, whether it is time to see someone that specializes in skin?
Yeah. Look, I don't actually think you should ever give up on your skincare at all. Whatever you do would be an addition to your skincare. Think about it as if like you were on a really healthy diet to improve your health, etc. And you're going to the gym to do all of this, but you don't really eat well at home. It's a bit like that. There's no point going and spending hundreds and thousands in a clinic or a facialist and then not doing the basics at home. You will end up losing a lot of money and not having consistent results over time. So I say whether, you do that in-clinic treatment, you should also find a practitioner that can give you really good advice for home if you are struggling. Now, where that becomes a little bit difficult is that skincare has become so much more complicated than where we were 10 years ago. I actually find that a lot of medical practitioners, whether they are dermatologists or GPs, they know the basics of a skincare routine, but a lot of them don't actually know what's out there in depth, especially when it comes to ingredients, ingredient combinations, how to use them all together, what they should avoid. So I feel like that's a big gap currently that I find when I have patients come in clinic with me and they've been everywhere and they're trying to put all of the little pieces together and they're struggling because I feel like the advancements of skincare plus it being part of medical advice plus all of it working together holistically is missing at the moment. So I think it's really hard to find that one person that understands everything, whether it's your dermatologist that's got a really good understanding of skincare, whether that's your GP, or whether that's a cosmetic doctor like myself saying, for example, this acne treatment that we're doing is not working and you need to go to a dermatologist and seek help somewhere else. So I find that we have everything, but currently I feel like in some parts it's hard to communicate it and make sure that I see everyone in clinic and I call them patients. Patients are getting the best outcome, basically. It can be a bit complicated, especially because half is public, half is private, and then you've got the same person being like, oh, I'm having 2-3 facials here and there as well, and it's just really hard to make sense of it all. And the only person that I feel like I can educate is the person sitting in front of me and guiding them on where to go. Sometimes that will look like me saying, I don't think you should be getting micro needling, for example, until your acne is managed. I think you should go and see a dermatologist and be put on some treatments. Sometimes they go and come back and they're like, the dermatologist put me on Roaccutane, but they didn't tell me how to use the rest of my skincare treatments. And then they come back to me for a bit of advice. And it's really hard, actually. Like, it could be quite overwhelming for something so simple that has grown a lot in the last 10 years.
Absolutely. Preaching to the choir here. I'm a content creator and I chat to a lot of women in my DMs that have experienced like that very typical adult acne, and it's kind of like, Minnie, what's worked for you? I know you've cleared your skin over time, but often what's happened is they have tried to do it themselves at home. And now they're at a point where there is scarring, significant scarring, and sometimes potentially permanent scarring or pitted scarring where they've lost like volume in the skin. My question here would be, when should someone actually start to engage in more help in either the medical system? Should someone go straight to a doctor in that case if they have acne that's making them feel self-conscious? I'm just thinking of like someone experiencing hormonal acne. What is an example situation that perhaps they should follow? What track should they be on?
I think as soon as you are noticing something that's bothering you, so if you're thinking like, okay, I had 1 to 2 pimples last month, now I'm having quite a significant breakout, I'm trying all these new treatments that I'm seeing online and I'm reading that it helps and it's just not helping, I would see someone like as soon as you can. And I understand that not everybody has access to care, especially because in Australia now, we pay for quite a lot of things. Even less and less GPs are able to bulk bill. So I understand that sometimes help is not as accessible, but if you can access it, see help quickly. Treat like conditions like acne, they're not cosmetic conditions. They are actual medical conditions that need advice, care, especially because if you're seeing your scarring, that's significant. Scarring is permanent. Whether one or two, it's really hard to undo the damage from scarring, and you can never really get rid of it. You can only ever make it look better with time, and that comes with hundreds and thousands of dollars of treatments worth. But if you're finding that your acne is not just a couple here and there, and you're having significant breakouts, it's stopping you doing your normal day-to-day things, you're constantly thinking about how to treat it or cover it, and you're seeing quite significant redness and scarring following it clearing up, you should definitely be seeing someone. I think the longer you leave it, the more scarring you can have and the longer implications that can have.
Thank you. A very succinct answer to a very choppy question.
It's hard because I feel like people see like breakouts and acne as just having a few spots here and there, and often wrongly is associated with teenage years. And the amount of times that I hear people being like, I can't believe I'm having breakouts in my 40s, my 50s. It's not a teenage skin concern or condition. It's a condition that can impact us from our teen years all the way through adulthood, and you may have really clear skin as a teenager and just develop acne in your even 40s, 50s when you're going through premenopause or menopause.
And there are significant skin changes over a lifetime. When are some of those big skin shifts in our life? I know my skin as a teen in high school was very different than my skin is now. And when I turned 20, that's when I started experiencing hormonal acne and a lot of that really dark purpley scarring. And now my skin is probably the clearest it's been in my life. What are some of these stages that people can expect?
That depends if you are male or female. It's directly linked to our hormonal shifts as a woman. So when you first notice these hormonal shifts is during puberty, and then you do go through a phase of, if you do get pregnant, you've got pregnancy, breastfeeding, premenopause, menopause, and you do even have, even if you don't go through pregnancy and breastfeeding, you do have hormonal changes throughout your entire life. And unfortunately, our estrogen is constantly on a decline from a certain age as well. And that massively impacts how our skin feels. And the levels between estrogen and progesterone also impacts breakouts. This is why, for example, a lot of treatments do involve hormonal balance for acne medically. So you do have a lot of these changes as you age and as you go through life. And it does have ups and downs. I would say with men, you can have adult acne as a man as well. It's directly linked to testosterone levels and oily production, and that can also fluctuate as a teenager, as an adult. There is no specific rule. It's not, oh, if you've had acne as a teenager, you're always going to have acne, or if you didn't have it, you're not going to have it in the future. It's honestly part luck whether you're going to get acne as an adult, as a teenager, and a lot of it's to do with genetics as well. Of course, you've got your environmental factors that really can contribute. Your lifestyle really matters. Definitely, if you're thinking about environment, you're thinking sun exposure, it can really impact the skin barrier. If you're having breakouts, that's a skin barrier that's not compromised, so it will impact how well your skin heals and the redness and the scarring. So your environment absolutely has an impact, but I would say when it comes to something like acne, a lot of it is genetic predisposition and the hormonal changes as you go through life.
Absolutely. I totally agree. And I feel like people are just trying to do it at home so much, trying to DIY their skincare so much when their skin is getting worse and worse in terms of their skin concerns, in terms of, oh, I really don't want this scarring, and I'm now making my scarring worse. And what I would love people to understand is that, unfortunately, there is a line where things get pretty permanent when it comes to the damage that we can do with skincare. So someone could actually potentially damage their skin with skincare, things that you can buy at the pharmacy, and do permanent damage. And I hear this story a lot because, of course, I'm speaking to women with that really typical acne that can cause that level of damage. But it's very heartbreaking when someone realizes, great, like I now have tens of thousands of dollars ahead of me if I want this to look how I want it to look again.
And it will never, like if you've got scarring, your skin is never going to be without that scar. You can only ever improve the appearance of it. The other thing that's worth noting as well is if you suffer from anything like acne, you are so desperate to clear up your acne, you will buy anything. Like, you are the easiest person to market to and to sell to. And what I find is that people come into clinic and they've got this like entire chemist in their bathroom, and they're chopping and changing constantly, which is probably the main cause for their skin irritation and compromised skin barrier. And these can just be really like weak chemist products that are being used wrongly, or you're changing too much and you're not giving a skincare a proper chance for it to work before moving on to something else. And most of it is because they constantly get targeted at by ads, basically. Use this for your acne prone skin, use that, it will clear up your blemishes. And people buy into it because they're desperate to clear up their skin. I've been there before. As a doctor, I've been there before. I've had acne prone skin, and you're like, oh my god, what if this helps? What if that helps? But in order to see if something actually helps and it works, you need to be giving it weeks. And unfortunately, we do not have the patience for that in this day and age.
So in terms of skincare timelines, how long does it take for products to work? Do different products work on different timelines? Are ingredients, formulations?
Absolutely.
It always feels like there's too much that impact how quickly a product works.
Oh, totally. Look, you will get some instant, like, results. For example, hydration. You can instantly hydrate your skin. This is why moisturisers are so satisfying. They add that hydration, especially with products with glycerin and hyaluronic acid, and then you've got other things like squalene in it that can actually make a quick impact, and you can feel it, so it's satisfying. You stick to it, you like the product, you rebuy it. Then you've got your other products, for example, that you are looking for. Let's say you're trying to reduce pigmentation, right? So any tyrosinase inhibitor, these are pigment reducing group of ingredients, they will literally take months. They will take months to work. Your pigment could be dermal, it could be epidermal. You don't know how deep it is as a layperson. Even for me, sometimes I see patients in clinic and it's hard to know how deep the pigmentation is. If you think about it, this tyrosinase inhibitor ingredient is trying to reduce the overproduction of melanin in that specific area, but at the same time the skin needs time for it to turn over so that you do get rid of this pigmented top layers of the skin and you get fresh new skin coming up to the surface. This takes months. So then people are trying to reduce pigmentation in a couple of weeks. Of course the product is going to be disappointing. Of course it's not going to work. It isn't magic. For example, pigmentary ingredients, you're looking at, honestly, 3-4 months. Retinoids, vitamin A as an ingredient is very popular, one of the main ingredients with so much research on it. Amazing for increasing your cell turnover, reducing breakouts, improving the overall texture. Again, you're going to need at least 1 to 2 skin cycles. This is approximately 45 days above for you to see results. Same with any like glycolic, lactic acid. Yes, they do provide that instant exfoliation, but it does take time for them to have that collagen production and increasing the cell turnover and improving the texture impacts of the ingredient. So they're going to take weeks for it to work. But for example, salicylic acid, it could be oil soluble. It can reduce that oily production on a day-to-day basis, and you use it more often because you're seeing that immediate. So it really depends on ingredients and what you're trying to get. Anything long term, so if you're thinking of reducing your breakouts, controlling the oily production with something like niacinamide, takes weeks, takes months. If you're thinking of reducing your pigmentation, takes months. Definitely anything to do with reducing fine lines and wrinkles at home, you're looking at 6 months. Sometimes consistent results, 6 to 12 months for you to notice a difference. But you see all of these marketing terms being thrown around, like plumper skin, more hydrated, reduce the appearance of fine lines and wrinkles. I think what really needs to be communicated is how long you need to be using these products for.
Is it fair to say some of those quick results that are shown online, sometimes it's working on those shorter acting, like you mentioned the moisturiser,
Yeah.
a lot of the plumping is happening from like better skin hydration,
Yep.
or perhaps some of that really quick blemish busting power is because something was very antibacterial and dealt with something very quick, but longer term that isn't always going to give the same results.
Yeah, absolutely. And I think when you're looking at like before and after photos as well online, unless it's been done through a scientific publication that is completely independent, it's always going to have a bit of bias when it's that brand doing the before and afters or doing the clinical trials. They usually are smaller, Clinical trials, they can have a bit of bias. You're only ever going to use your good before and afters if you are going to be promoting a skincare as well. No one's going to be like, hey, this is a before and after and it didn't do anything. You're not going to be showing that. So I feel like it does sometimes up people's expectations of what's real, what they can achieve realistically at home.
In terms of skincare basics, if someone was really new to skincare, they wanted to start and they didn't want to spend that much money, what are the products that they should absolutely have in their routine?
So I say if you're literally like starting from scratch, the basics should just be a cleanser, a moisturiser and an SPF. A lot of people can be on that long term and that can be sufficient products to look after their skin and their skin barrier, especially if they don't have any specific skin concerns. They just want to look after their skin. With cleansers, moisturizers and SPF, honestly, there are so many great budget-friendly options from local chemists, from really good brands.
In terms of affordable brands and very expensive brands, does that matter for the average person that just wants the really basic skin health? When should you actually splurge on skincare?
Not for your cleanser, moisturizer and your SPF. You do not need to be spending hundreds on any of those products. And even myself, I have access to really good bougie expensive skincare, and sometimes I do just go and pick up the basics because that's just what I need, and my skin doesn't need a bougie cleanser, it just needs a basic cleanser, a basic moisturizer. And with sunscreen as well, I think like I literally use really basic cheap sunscreen in Australia because the quality is pretty good over here. When I would say go ahead and splurge is when you've got specific skin concerns and you want to directly target them. So this is fine lines and wrinkles, pigmentary issues, oily skin, you want to improve your overall texture. You're not going to just get that from your 3 steps of washing, moisturizing and SPF. So that's where I would splurge.
Something that's pretty interesting, it comes up every now and then as someone who talks about skincare day in, day out, but is not a professional. I often hear, do I have to buy the skincare range that my dermal therapist is recommending? They have it in clinic. Yeah. This is what they have. And they're very insistent that this is what is going to make my skin better, but it's hundreds and hundreds of dollars. And I'm already splurging to go and see the dermal therapist. What would you say the situation is?
It's quite a hard one because it honestly depends on their skin concerns. You would find that if I had 10 cases, I would probably agree with half. For example, yes, they do need these products. The other half, you can probably find cheaper alternatives from the chemist. I think a good practitioner should always work backwards with that individual's budget. So if you've gone to a clinic, I think the best way is to always say, this is my budget. Can you realistically help me within this budget? And sometimes it's okay for them to say, no, look, you need X amount of treatments, this is going to cost this much. We need you on clinic only skincare and that's going to cost that much. But I don't agree that you have to be buying all of these in-clinic products. Because look, we have in-clinic products in the clinic I work at. And if my patients, look, I can't afford all of it, I will then make a bespoke plan using some budget-friendly products from the chemist and then maybe 1 to 2 products from the clinic that are absolute musts. And sometimes I even say to them, I want you on this product so much more than you having in-clinic treatments with me. Like at home is so much more and these products will give you way more than I can in clinic. That's where I think it's then worth it for people to spend that money. Otherwise, I think it's hard because, look, it's a business. When you go and see someone, when you go and have a facial and they want to sell you 5-10 products at the end of it, it is a business. It's no different to your Clinique counter at David Jones, for example. They want to sell. So sometimes it's better to pay for independent advice, for a consult, and get someone to, you pay for their time so they don't need to sell you products, rather than go to a clinic that's associated with various brands and that's how they make their income. It's hard. It's really hard. It's hard to navigate this area.
Maybe this is a good opportunity to chat about green flags and red flags when engaging with a skin professional. And perhaps one of them is working with your budget and being really honest about what they can achieve with what you have to spend and your skin concerns.
Yeah, totally. Honestly, you should, if you're looking to get help, one, it's really important to know who to go to begin with. So if you think it's a medical condition, see your GP first. You could spend a lot of money and not get far if you're seeing the wrong person. Let's say you see, I don't know, a cosmetic doctor like myself. It's easier to make myself as an example. You're better off paying for my time, where I can give you independent advice regardless of brands, and just be like, okay, this is your budget. Let's say you've got $400 for a skincare routine every 4 to 6 months. This is where you should be spending your money. This is where you could be saving your money, and these are the ingredients that are high priority for you. Like, for example, I see people who would be like, I'm really struggling, etc., etc., and they're spending, I don't know, over $100 on a Thatcher moisturiser. And I'm like, you could be putting that money towards more stronger active ingredients that could be actually tackling your skin concern. So I would say if you're trying to find someone, then I think transparency is really important. Telling them what your budget is, telling them how often you want to come and see them for in-clinic treatments. And I would say it's a green flag if you say to them, look, I can't afford what you've said. Can you give me, I know it won't be the same, but can you give me an alternative that can have similar benefits that isn't as expensive, that I could buy from Priceline or Chemist Warehouse, for example? And I think that's a green flag. I think that if they're willing to give you information to really help you rather than just sell you products and sell your treatments, I think that's where people build long-term relationships with people.
And the long-term relationship piece does seem really important for a skin health journey and the changes. I guess you really do want to engage with someone that understands your skin, understands your budget, understands basic things like allergies and how invasive you're willing to go for certain concerns.
Yeah.
And just managing some of that.
And look, like, if you imagine, it takes a while and a lot of products to do trial and error to see what you like. You don't want to keep doing that with a different person. So if you're going to get help, and if you're going to get somebody to help you with your skincare routine, you're better off seeing one person, so make sure you click with them. And if you're not sure, just move on and go somewhere else. Because imagine starting that journey over and over again with different people. It can be quite costly.
Absolutely. Like, just in skincare, sometimes I have conversations where someone has tried X amount of different products for this X amount of like skin concerns, and they're at a place where perhaps their skin is more scarred or more compromised than when they started. And the conversation I have as just a very skincare novice is perhaps, you know, that money, instead of going through that whole trial and error again, is best spent at a professional's office. Maybe one session of a laser that was really targeted to what your concern is going to be much more beneficial for your skin and much more cost effective than trying another 10 serums.
Yeah, definitely. These like, skincare isn't cheap. Like, you could be spending easily like above $250 for one product sometimes. And these are products that have promised a lot to people. That's why you would splurge on them. But you don't get the result that you want so quickly through anything that you do at home. It all takes a long while. So yeah, you're right. You're better off actually sometimes spending that money. For example, like if you've got hyperpigmentation that you're trying to improve and you've spent, I don't know, thousands on serums over the years, you're probably better off just getting one laser treatment that would reduce it significantly. And then you could go back to the skincare and maintain your results.
Yeah, I'm definitely of that frame of mind, especially when you're seeing the skin concerns that people do express. It's, oh yeah, serum might be able to start kicking that back in 6 months, and that you have to buy a new bottle every month, but that adds up to a pretty gentle peel in an office somewhere with like great aftercare and like great skin insight. Maybe that is actually just a better spend of your money. But it is about access and education.
Yeah, I also do think it's really important to manage people's expectations when it comes to skincare. I think because there's such a big emphasis on skincare, people think this set of, I don't know, 5 to 6 new products they've got is going to transform the skin. And sometimes it does really improve your skin health and it will look better over time. But the expectations that we have sometimes are insane. I have people who really struggle with, for example, the skin on their neck, and they're spending decent amounts of money on these neck creams and neck serums. And sometimes in my head, I do think they're expecting like a surgical like neck lift result and creams, and it's just not the case. I think we need to be a bit more sensible with what we are actually expecting from our skincare. And then that way we would make better decisions when it comes to spending our money as well.
Absolutely. Also, around the eye area is a very common point of concern, like under eye darkness, under eye
Yeah.
hollowness.
Yeah.
And it's okay, like there are definitely things we can do. There's eye creams that have like reflectance in them, a bit of color correction, eye
Yeah.
creams that work on pigment, if it is pigment actually causing that darkness. But there are limitations to this. What
Oh.
areas of skincare would you say there are bigger limitations that one people think?
I think anything that promises improvement of scarring, then I would say that's insane. Even in-clinic treatments really struggle to improve scarring. So scarring, just be mindful if anything is targeting that. I think pigmentary issues, depending on how long the pigment's been there, if it's a medical condition like melasma, for example, again, really hard to treat at home with your own skincare routine. If you've got hormonal acne, this is an internal issue. Skincare can reduce the breakouts to a degree. It can improve the skin quality. It can reduce the oil production. Again, you're going to really struggle to fully manage it at home without medical guidance and input. Even conditions like you mentioned, dark under eyes, that sometimes that one dark under eye concern could be caused by so many different things. It could be hollowness. It could be pigmentary genetic concerns. It could also be congestion in the face, can sometimes lead to a bit of darkness under the eyes. Like, it could have so many different causes to the same concern that you can't really treat with 1 to 2 items. And sometimes there is no treatment for them. This is the other thing. Sometimes there is no treatment for them. If you're thinking of under eye hollows, the only way you can treat that is with cosmetic treatments. Sometimes I find that 80% of those patients are not suitable for those treatments. You can have surgery, but apart from that, you're not going to be able to fix that concern with any skincare at home.
And then on the counter side, what skin concerns are really appropriate for skincare, and what concerns can someone manage really well at home by buying that targeted serum, or perhaps like buying that special moisturiser?
So I would say if your skin is feeling like dehydrated, dry, sensitized, itchy, tight, I think that's a really good group of concerns that can be targeted really well with skincare. Absolutely. I think there are so many great products and ingredients on the market to tackle that.
Can we do like a walkthrough? Let's just say I'm doing a skin check at home. I notice a mole that I think has changed. It looks a bit sus. What would be the next step I take?
See your GP.
See my GP.
Yeah, see your GP. GP can usually have a quick look at it. A lot of the GPs in Australia are so well trained at picking up skin cancers. Otherwise, you can also go to a skin clinic. A lot of skin clinics in Australia have GPs that have specialized in skin cancer, and then next is a dermatologist. However, the one thing I have found is that the wait list to see a derm is insane. So don't delay it because you want to see a derm if you can't get in. See your GP or a practitioner at a skin cancer clinic, which is usually a GP with a special interest in skin cancer. So that's definitely number one. Get it seen ASAP.
Yeah, amen. Amen. I get pretty stressed because I think a lot of people hesitate to check on spots, to check on moles, to take that next step because they feel like they need to see a derm, and then of course comes the cost, and then of course comes a really long waiting list, and then there's just more barriers there. But you really can just see your GP and be like, I'm worried about this spot. What do you think? And then they might give you a really good next step. Yeah.
I've literally had very similar cases where I've been injecting someone's face, and I'm like, hey, what is this little lesion on your face and how long has it been there for? And like, yeah, I'm still waiting to see my derm in 2 months' time. And I'm like, what are you doing waiting? Go and get this checked, like, immediately. I think also what it is, I'm a UK trained doctor, and like skin cancer is still a cancer. It's a big deal for me, and it should be for everyone. But I feel like in Australia, it's like so normal. It's people are so relaxed about it, and it is so dangerous because you don't actually know the severity of anything. If you can't get into your favorite derm that you want to see, your GP and lots of skin cancer clinics will have availability for you to be seen sooner.
Absolutely. And the sooner you see them, the sooner you engage, usually they can limit a lot of whatever needs to happen. For my story, I had a mole that was raised, the color was different, the border was fuzzy, and I wasn't really quite sure. I showed my GP. They said, yep, it's time to show a derm this. They'll take a little sample, they'll do the next steps. When they did sample the mole, they said, this is atypical. The cells are worrying us a little bit, and because you're so young, we're going to go back in and get some clear margins. And they ended up taking a pretty decent chunk out of me to get clear margins on this mole. And I can't imagine if that was on my face, what level of reconstruction they would have had to do, because it ended up being maybe 8 stitches, very deep to the point where the skin sinks in. And I was quite lucky, like that was just an atypical mole that they were just a bit sus on and playing it safe. Yeah. But I've definitely seen people underestimate how serious skin cancer is, even if they're just taking clear margins, even if they're not putting you on any further treatment besides just making sure everything's excised. Yeah. And then they're commonly on the face, where you might absolutely want to limit what's happening.
Yep. And look, the sooner that you see someone as well, if something seriously is wrong, they can expedite a specialist input as well. You know, if it is something on your face or, you know, somewhere that's quite visible and you want a plastic surgeon or a dermatologist to look at it, if it is serious, then your GP or another skin cancer doctor in another clinic may be able to expedite you seeing somebody to address the concern with exactly the specialist that you want. So definitely don't sit at home with anything that you're sus about, and 100% do regular checks on all of the exposed areas.
Absolutely. Maybe we can wrap up by quickly chatting about like what signs are people looking at for spots and moles or changes on their body that should give them a red flag.
I actually think the red flags, I know we've got your usual check for the border, check the color changes, check if it's raised, has anything changed, but I actually think we should have a very high suspicious rate for anything that is not looking right. If it's a scab, it hasn't improved. It doesn't need to be mole. I think people think that skin cancer is changes on a mole, but actually it can be a change that is looking a bit funny, you've never noticed it, you don't have it anywhere else on your body, is looking a bit pearly, a little bit shiny, a little bit scabby, anything that's you're unsure about, you should get it checked. It's not always a mole. I think that's one message I want to put across. Is not skin cancer is not just a mole looking funny or a new mole. It can be anything else.
Wow, that's a really helpful shift, because obviously it looks very different depending on your skin tone, what these can show up on the skin like. And I've always just had in my head, oh, something new or something that I've had for a while that starts to change. But you're saying just have a really high level of suspicion and just be really safe and have these conversations quite regularly with your GP.
And I think, like, regardless of the color of your skin, if you're living in Australia, you should be having annual skin checks where if they are concerned about anything, they could do mapping of your skin and have records. Going to the same clinic really matters as well, so that you've got that continuity of care. But there's actually no excuse for it in Australia, because we have such good clinics and there are so many, like every corner you can find a skin cancer clinic. So I think it's really important to have those annual checks. Because I think there's so many areas you can't check, like back of your ears, back of your neck, your back of your legs. There's so many areas that we can't check ourselves.
Yeah, and a step beyond that, like maybe we could check ourselves. We're not even exactly sure what to look for. And I've definitely seen GP stories that specialize in skin cancer when they show a skin cancer. And I've looked at it and been like, wow, I would not have thought that. No. I would have just thought that was a spot, or that was a little rash, or that was just like something really looks mundane to someone like me. But a specialist would be like, let's get that checked. Let's do the extra step.
Totally. I send people for a check so much in clinic, because I'd be like, hey, you've got a scab on your nose, how long has that been there for? And this thing, and I keep picking at it, and this come back as like squamous carcinoma, and you're just, oh my god, you should have had that checked weeks ago when it came and it wasn't healing, for example. It's really hard. You don't know what you're looking for, and I think a lot of the attention about skin cancer is on moles, because melanomas are the most dangerous type of skin cancers. But you can have treatments for BCCs and SCCs, but it does have cosmetic complications for people. And at the end of the day, if something is wrong, you want to be getting it checked.
Absolutely. And especially when a lot of these do show up on places that people do care about how they look.
Yeah.
And like, that's not shallow, that's just a reality of the situation, and we definitely want to minimize as much as we can any invasive full stop, anything invasive full stop, we just want to minimize. So
I deal with a lot of scarring on the face, and I would say 95% of it is due to removal of skin cancers on the face, and that does impact the volume of one area compared to the other, the tethering, how even muscles are pulling and pushing. So it's not just the actual scar appearance, it's the full implications of what it does to that area.
yeah,
Which is why
absolutely.
sunscreen is really important. Prevention is always better.
Amen. Yalda, thank you for your time. Was there anything
Thanks.
that you wanted to share about skin? Any hot takes? We're all ears.
No, I think we've covered a lot. I think, honestly, my biggest tip is if you're struggling and you're feeling so overwhelmed, it's okay to go and see someone for help, whether that's your GP or a cosmetic doctor or your dermatologist.
Yeah, absolutely. Thank you, and
Thank
cut.